Good afternoon, dear colleagues. Today's our topic is peculiarities of water and mineral metabolism and acid-base state of the organism in children. From your anatomy and physiology classes, you remember that water, electrolytes, and blood pH in the body are in the constant interaction. Water takes one of the most important part in the body. Water carries nutrients and oxygen to cells. It moistens oxygen for breathing. Also, water helps convert food to energy, protects and cushions vital organs, helps body absorb nutrients, makes up 75% of muscles and 83% of blood, cushions joints and removes water, composes 75% of the brain and regulates the body temperature. The value of water is especially great for the child's body. A large amount of water in tissues is a necessary and constant condition that ensures the possibility of rapid growth of the child. All basic life processes, especially enzymatic and normal thermoregulation, are possible only with a sufficient amount of water. But we have to remember that loss of water with feces is 3 to 10% of the absorbed fluid, with urine 40 to 50% and more, through the skin and lungs 50 to 75%. At this slide you can see the ways of removing water from the body. With urine, due to respiratory tract or perspiration, evaporation from the surface of the skin, with sweat, with feces. But without water, death occurs after 5 days. Where does the body store water? There are some water spaces. First is extracellular. It's divided into intravascular and interstitial. The second is intracellular. The last is transcellular space. All fluid in the body is distributed as follows. 5% is plasma, 15% is body tissues fluid, and 50% is intracellular fluid. At this slide you can see how many water contains different tissues of the body. The leader is blood, 83%, and the smallest amount has adipose tissues, 10%. Water content in the body is directly proportional to age. The total water content in newborns is 75–80%. Compare with preterm newborns, 81–85%. Plasma and intercellular fluid are solutions of sodium, chlorine, bicarbonates, calcium, magnesium, phosphorus, and protein. The extracellular fluid provides a normal volume of circulating blood. The older the person, the less water in it. With age, cells lose water. The aging process is a drying process. Extracellular fluid provides building materials, nutrients, body temperature, osmotic pressure, pH, concentration of organic and inorganic compounds. The main extracellular fluid cations are sodium, potassium, calcium, magnesium, and the main anions are chlorine, bicarbonates, orthophosphate, sulfate. What is the role of sodium in the body? The requirement of sodium is 3.5 to 5 millimole per day or 1 millimole per kg. The level of sodium in serum is 135 to 150 millimole per liter, an average of 142 millimole per liter. Sodium creates osmotic pressure in liquids and keeps volume of liquid at standard level. Sodium attracts water and determines the tone of arterioles. Next cation is calcium. The daily need for calcium in newborns is 70 to 75 milligrams per kg. But in prematures it's much more higher, 200 to 225 milligrams per kg. Calcium provides a lot of vital processes. Affects nervous muscular excitability. Participates in growth processes and mineralization of bones. Participates of coagulation of blood and reduces capillary permeability. The main source of calcium for children is milk and dairy products. Next cation in our list is magnesium. The need for magnesium is 11.5 to 14 milligram per kilogram of body weight. Average amount of magnesium in the blood is 7 to 12 millimoles per liter. The magnesium content is much higher inside the cells than outside them. As well as calcium, magnesium determines nervous muscular excitability. Takes part in the exchange of phosphoric macroarteric structures. Magnesium is a part of various nucleotide exchange enzymes and part of bone tissue, including teeth. Also, it is basic cation of soft tissues and antagonist of calcium. The main sources of magnesium are beans, cereals, nuts, meat, and milk. Now consider the role of phosphorus. Daily requirement for phosphorus is 40 mg per kg, but for preterm it's much more higher and consists 100 to 100.5 mg per kilo. Lack of calcium and phosphorus leads to bone deformation. One of the most common diseases in children in the first year of life is rickets. Next very important microelement is iron. Daily requirement of iron for first-year babies is 11 mg. Premature deficiency is manifested by anemia with microcytosis and polychromatic erythrocytes. Reserves in newborns makes up 2 to 300 mg. 80% is iron of hemoglobin. 8 to 10% is myoglobin, and 1% is tissue cytochromes. Iron exists in two forms, heme and non-heme. Heme iron is associated with a large organic molecule that holds it. In the intestine, it is absorbed much more efficiently than non-heme iron, which is inherent in plant products. The main sources of heme iron are red meat, liver, fish. Non-heme iron is quite poorly absorbed. In the alkaline environment of the small intestine, iron forms an insoluble precipitate of iron hydroxyl and becomes inaccessible. Non-heme iron is found in supplements and plant foods. Most iron is found in nuts, legumes, buckwheat, prunes and dried apricots, greens, and kale. Breast milk contains iron, but its amount is insufficient for children older than 4-6 months, so they are given complementary foods, like vegetable and meat puree, egg yolk, and so on. Zinc is next in our list. The daily need for zinc is 3 mg. Zinc promotes the formation of new cells, tissue repair, improves immunity, activates more than 200 enzymes necessary for digestion and assimilation of food, stabilizes the structure of DNA and RNA, reduces the risk of mutations, helps synthesis collagen, insulin, sex hormones. Main sources of zinc are meat, poultry, legumes, pumpkin seeds, yogurt, eggs. Zinc deficiency can reduce the sense of taste and smell, cause flaking of nails, white spots, prostate diseases, infertility, high cholesterol, poor night vision, susceptibility to infections, cold and flu, skin diseases, anemia, slow wound healing. One more very important microelement is potassium. Potassium level in blood plasma is 4.3 to 4.5 millimole per liter. Potassium is one of the most important ions in the body. The main somatic active component of the intracellular fluid. Participates in the function of many intracellular enzymes. Provides electrophysiological and energy processes inside and outside the cells. Provides normal muscle tone and participates in the synthesis of proteins and glycogen. Dear colleagues, we have completed discussing the main characteristics of water electrolyte metabolism in children and the role of essential trace elements. Thank you for your attention.